to the session on developing an effective questionnaire. And today we will talk about what it takes to design an effective questionnaire that provides accurate, reliable, and actionable data. But before we get into the specifics of designing a questionnaire, let's start with a basic definition and understanding of what a questionnaire is. So, a questionnaire is a research instrument consisting of a series of questions designed to gather information from respondents. And it can be used to collect both qualitative data and quantitative data depending on the type of questions being asked. So, questionnaires are typically used in surveys, as you all know, and they can be administered in various formats, including paper, online, face to face, or over the phone. And the common uses of questionnaire are first of all in research. So questionnaires are widely used in academic and market research to gather data on wide range of topics like consumer behavior, opinions, and preferences. For example, in healthcare, the questionnaires might be used in clinical trials to gather data from patients about their symptoms or quality of life, right? Other common use of questionnaire is organizations use them to gather feedback from customers, employees, or patients. Then questionnaires are also used to evaluate health programs, products, or services. For example, a public health department might use a questionnaire to evaluate the effectiveness of a community health program. And they are also otherwise used to assess attitudes, beliefs, and opinions on various subjects. So, the questionnaires are a versatile tool that allow us to systematically collect data on a variety of topics. So, whether we are measuring satisfaction, behavior, or attitude, a well designed questionnaire can provide valuable insights, right? So, see, anyone can jot down a question and call it a questionnaire, but creating one truly captures meaningful data is a craft, and it requires careful planning and design. For instance, imagine designing a patient feedback form for a hospital. So, if you simply ask, were you satisfied with your care? You won't get actionable insight. So, instead, you need to consider what you want to measure, like specific aspects of care, say wait time, interaction with staff, or clarity of communication, things like that. So, thus, producing worthwhile data and generalizable data from questionnaire needs careful planning and an imaginative design. And our focus today is to explore how to develop such questionnaires that not only meet research goals, but also ensures that the data you collect is usable. So, the importance of questionnaire development and validation cannot be overstated, because a questionnaire can make or break your research and the data collection efforts. So, number one is the validity assurance. This means ensuring your questions accurately measure what they're supposed to measure. For example, if you're measuring patient anxiety levels post surgery, you should ensure that the questions they capture anxiety rather than the general discomfort. So the validity assurance is very important. Second is the quality of the research. A validated questionnaire enhances the quality and credibility of your research. In all fields, but particularly in healthcare, validated data leads to better decision making and patient outcomes. So evidence-based practices and data usability. So one important purpose of questionnaire development and validation is that the data you collect, it needs to be structured in a way that it is easy to analyze and draw conclusions from. However, there may be some key challenges that you might face when developing a questionnaire. And these challenges can directly impact the quality and reliability of the data you collect. So, first of all, sampling error. This occurs when the group you are surveying does not accurately represent the population you are interested in. For example, let's consider that you are conducting a patient satisfaction survey in a hospital and you survey only patients from a single ward. say maternity ward. So this would result that your study wouldn't represent the experience of patients in other wards, right? Say emergency, oncology, others. So to avoid the sampling error, you must make sure that your sample covers all relevant patient groups, right? Now the second one, the frame error. This may happen when the list from which your respondents are drawn is inaccurate or incomplete. So we must always ensure that the respondent list we have is up to date and complete. When not everyone in the target population has an equal chance of being selected to participate, then selection error occurs. So another example is if you are conducting a survey on healthcare workers, say healthcare workers' job satisfaction, but you only survey doctors and you omit the nurses or administrative staff, you are introducing selection error because the data you will collect will only reflect the views of the doctors. It will miss out the experiences of other critical healthcare workers like nurses and administrative staffs, right? And here, going for a random sampling can mitigate the issues. Another error which is common is the non-response error. And this arises when some people do not respond to your questionnaire, potentially skewing your results. Say you are surveying elderly patients in healthcare. So they do not tend to respond because they are less familiar with technology. And this non-response that can skew the data towards younger, more tech-savvy patients. So to reduce the non-response error, we can consider alternative ways for people to participate, such as we can offer both online and paper surveys. Yeah. And measurement error. And this occurs when your questionnaire does not accurately measure what it is supposed to. For example, in the same patient satisfaction survey, if you ask, did you have a good experience during your hospital stay? And you're not specifying here what good experience means. Maybe you can ask about wait time, cleanliness, staff behavior. So here, if you don't ask these aspects, you might get vague responses that don't actually measure patient satisfaction. And to avoid measurement error, we have to make sure that the questions which we are using are specific and clearly defined. And that is why we are here today for. So here we will be discussing in the coming slides of how to develop and design an effective questionnaire that is able to measure what it is supposed to measure. Now, each of these challenges, they compromise the quality of the data you collect. So it is crucial to plan carefully and avoid these common pitfalls. Now, it's important to remember that there are no absolute hard and fast rules of how to frame the questions, right? But there are some key guidelines that you can follow. And the first one is the questionnaire should first of all meet research objectives because this is the critical function of the questionnaire. So every question you include should serve a purpose and that shall contribute to the overall goal of doing that research, right? It should be able to obtain complete and accurate information. See, it's not enough to ask the right questions only. You also need to ensure that the respondents, they provide complete and accurate answers. So this involves structuring your questions clearly and ensuring that they are easy to understand. For example, in a survey about medication adherence among patients, if you just ask, did you take your medications as prescribed? A simple yes or no question might not give you the complete information. Instead, ask for a more detailed question. Say, how many times in the last week did you miss a dose of your medication? So this will help you to achieve complete and accurate information. So framing your questions in such a way is important. Now, another important point is the ease of responding and recording. It is always easier for the respondents to understand and answer your questions. And the easier it is, the better your response rate will be and the more reliable data will become. So here it is important to ensure that the language which we are using is simple and accessible. And especially if we are dealing with people who are from different educational levels or who come from different language backgrounds. So instead of using jargons, we should try to simplify the terms to everyday language, which is easy to understand so that the respondents are easy to reply. Similarly, the pattern of the questionnaires or the framing of the questionnaires should be in such a way that it is also easy for the interviewer to record them, right? So there should be an ease of responding and recording in the questions. And very important point is you have to keep the interview brief and engaging, because people are likely to complete your questionnaire only if it is concise and doesn't take too much time. In today's scenario, when everybody is running out of time, long questionnaires, they can lead to respondent fatigue, and they may abandon the survey before completing it or even provide less thoughtful responses. Now, when designing a questionnaire, choosing the right type of questionnaire is crucial to gather the most accurate and useful data. And there are several types of questionnaires, each with its own strengths and weaknesses. So, number one is the unstructured questionnaire. I think you might have heard about it. Unstructured questionnaire includes open ended questions that allow respondents to answer in their own words. So the format here is flexible and exploratory, as it allows for more in-depth insights. And usually this type of unstructured questionnaires are used when we want to explore new areas or we want to capture detailed responses that can provide qualitative insights. Another type of questionnaire is the structured questionnaire. Now, this is highly organized and consists of closed-ended questions. Closed-ended questions where respondents they select from predetermined answers, like provided them multiple choices or a yes or no or a rating scale option. So this type of questionnaire is ideal when you need quantitative data and when you want to ensure a consistency in your answers. So then you can choose going for a structured questionnaire. Another one is the semi-structured questionnaire. And as the name suggests, semi-structured questionnaire, they combine both closed and open-ended questions. So they are good because they provide a balance between the precision of the structured questions and the depth of the unstructured ones. And this is usually used when you need both qualitative and quantitative data. You get the benefits of having both, like specific comparable answers, but then also there is room for personal insights. And the last is the mixed method questionnaire, where uh, both qualitative and quantitative techniques are used to get a fuller picture. So it might include a range of questions such as multiple choices or scales, or and including open-ended questions as well. Also, so this is ideal when you want to do comprehensive studies where you want a robust understanding of both statistical trends and individual experiences. And the difference between the semi-structured and a mixed method questionnaire is semi-structured follows usually quantitative analysis or usually follows a quantitative one, whereas a mixed method involves the analysis of the data both ways. So it will include both qualitative analysis and a quantitative analysis. So we can say that structured questionnaires, they are good for large scale surveys where we want to have a consistency, but they will not have that nuanced responses that we want. Whereas unstructured questions, they are very good for capturing rich, detailed responses. But then the problem is they are difficult to analyze on a large scale. And semi-structured questionnaire, therefore, it offers the best of both worlds, which gives you the flexibility to capture detailed insights as well, also providing the data that can be quantified. Here, the type of questionnaire you choose depends on the kind of data you need and the context in which you are collecting it. So this is very important to consider once you are deciding on which type of questionnaires you will include. And in the questionnaire development process, there are certain preliminary considerations before you start. And out of this, the first step is to identify the construct you want to assess. Because the construct is the concept or the characteristic you want to measure through your survey. See, I have done a previous validation and development of a questionnaire where I was aiming to assess the common beliefs, myths, and stigmas towards mental illnesses among the general population. So here, I decided that my construct is I want to assess what the population has or feels, or what are their beliefs and stigmas about mental health sufferers or mental health patients. Thus, the first step where we are identifying the construct is very important. And after you do that, it is important to, rather, it is critical to perform a thorough literature review, because this will help you understand whether there are any existing works or existing similar tools or existing questionnaires that are already validated that you can use and adapt in your own study. The reason I'm saying this is because if you find an already validated questionnaire and you use it in your study, and it is something that matches your research objectives, using it can save significant time, money, and other resources as compared to the ones that will be invested in developing a new one. Another important point here is that if you already use a validated questionnaire, that allows you to compare your findings with the past studies that have already been done using the same instrument. So then here, while you are presenting your discussion section, you get similar studies to compare from. Yeah, and when submitting your research for publication, a validated questionnaire, if you have used that in your study, so and it has been already published and used in previous studies, it simplifies the process because you don't need to extensively describe the development of it. So here it also helps to have an easier publication. So these considerations are important while hopping on entirely to the questionnaire development. And you have gone through the literature review, but there are chances that you may find a suitable questionnaire, but it is in a different language. So now you have to make sure that you will have to get it translated. And it is important to note here that translation is not a one-step process. It involves both forward translation and backward translation. Now, by forward translation, I mean that you will have to translate the questionnaire from original language to the language you need. And backward translation means having the translated questionnaire translated back into the original language to ensure that the meaning of the questions hasn't changed during the translation. Let me make it more easier to understand. So if you found a questionnaire, but then you found it in a different language, say you found it in Lebanese language or a Chinese language or any other language, and you want to use that for a study in India. Now in India, we know that most of us are understand and know Hindi or English. So here, if you want to use the same questionnaire in your population in India, we will have to translate it properly, and we will have to use this two-step process of forward translation and backward translation before getting it into public use or getting it into the survey. And for this forward and backward translation, this is not your job, or it is not that you will get it, you can just get it translated through Google and all. It requires experts, specifically language experts, who will translate the questionnaire from one language to the other, and they will again revalidate the translation through backward translation. Okay. Now, you have, even after doing all of this, I mean, you have had a literature review and you did not find any questionnaire that meets your construct and that meets your objective that you want to find out, then you can move on forward with developing your own questionnaire. And developing the questionnaire, it involves writing new questions, based on the construct and objectives, ensuring that the questionnaire covers all necessary aspects of the concepts you want to assess. It also involves consulting experts in the field because you have to ensure that your questions are appropriate and aligned with the construct you want to measure. And after developing a questionnaire or adapting a questionnaire, you will have to validate it with the use and target population. So here comes the validation. And validation ensures that the questionnaire reliably measures what it is supposed to measure. And even if you develop your own questionnaire, consulting with the experts in the field is essential because you will have to fine tune your questions and you have to make sure that they are clear and appropriate and capable of capturing the information you need.